Hi everyone and welcome back to my channel. If you're new here, I run the Life with Scoliosis blog where I blog about my life and experiences of living with scoliosis. So what I've decided to do is put together a little education series all about scoliosis to try and help raise awareness of the condition and what it is. So in this video, I'm going to be talking about what is scoliosis, and I'll go through the causes of scoliosis, the common treatments of scoliosis, and some of the symptoms as well. What is scoliosis? To put it simply, scoliosis is a condition where the spine curves to the side, and this can either be the left or the right. There can be one curve in the spine which creates a C curve, or in some cases, which was my case, there can be two curves in the spine which creates an S shape. As the spine curves, it rotates as well, which causes the ribs to rotate. And this often causes, if you have a curve in your upper spine, it often causes a rib bulge to form on your back. This can be most noticeably seen when bending forwards, and it's often the first symptom that people with scoliosis or people around people with scoliosis notice first. This can also be noticeable as well on the chest. There can be some unevenness, and also the waist can appear uneven as well. Sometimes there can be leg length discrepancies as a cause of scoliosis, and hips can appear uneven as well, but it depends on the location of the curve and the size of the curve as well. Sometimes, as in my case, the shoulder blade as well will stick out on one side, which is where the spine and ribs have twisted and pushed out the shoulder blade on one side. So that's another common symptom to look out for. A scoliosis curve can develop in the upper spine, which is called thoracic scoliosis, or it can develop in the lower spine, which is called lumbar scoliosis. Sometimes, as I mentioned, in my case, a person can have a double curvature in the thoracic and the lumbar spine. And in this case, it can be difficult to spot the scoliosis straight away because the curves almost cancel each other out in those cases, and the person can appear relatively straight and balanced out. Scoliosis can progress over time and get worse as the person grows. It's often diagnosed in the teenage years and is often triggered by the growth spurt that teenagers go through, and it can often get noticeably worse quite quickly during this time, during growth. How is scoliosis diagnosed? An X-ray is usually done to diagnose scoliosis. Scoliosis is measured by something called a Cobb angle, and this is measured in degrees. So the bigger the Cobb angle, the more severe the scoliosis. Scoliosis is defined as a curve with a Cobb angle greater than 10 degrees. Most people in the general population that don't have scoliosis may have a very, very slight curvature to some extent, less than 10 degrees, and this is not considered scoliosis. Scoliosis curves that measure over 50 degrees Cobb angle have a much greater risk of progression, even when the person has finished growing. It's for that reason that people with curves over 50 degrees are generally recommended to have scoliosis surgery to correct the curve and prevent any future progression. If the curve is in the thoracic area and is very large, it can sometimes as well cause issues with the lungs and with breathing. What causes scoliosis? So in 8 out of 10 cases, there is no cause or no known cause for scoliosis, and these cases are called idiopathic, meaning there is no known cause. And that's the scoliosis that I was diagnosed with, so they don't know why it developed. Scoliosis is not preventable and is not caused by anything that the person did or did not do. There are some other types of scoliosis that are less common, that do have a known cause. One of these is called congenital scoliosis, which is caused by defects in the spine when a baby is in the womb, so it causes scoliosis to develop from birth. There is also scoliosis that can be caused by degeneration in the spine, so just general wear and tear as people get older can sometimes cause scoliosis, and also some conditions as well can also cause scoliosis, such as some underlying nerve and muscle conditions, although these are less common causes. The most common type of scoliosis is idiopathic scoliosis, where there is no known cause. This commonly develops between the ages of 10 and 15 during the teenage growth spurt. So it's very important during this time to be aware of the risks around scoliosis, and if you have a teenage child or you are a teenager yourself, it's important to check your spine during these ages, because the earlier scoliosis is detected, often the more effective the treatment is. It's also more common in girls as well, and it can be hereditary. What are the treatments for scoliosis? There are several treatments for scoliosis, but this will depend on the size of the scoliosis curve, the location of the scoliosis curve, and the age of diagnosis and how much growing the person has left to do. Smaller curves that are diagnosed in children and teenagers before the child has finished growing can often be treated by bracing and regular x-rays and monitoring. The purpose of the brace is not to correct the curve, but to stop the curve from getting worse as the child grows. Some cases of scoliosis may be so mild that they do not require any treatment. Larger degrees that are around 50 degrees or over at the time of diagnosis will be generally recommended spinal fusion surgery to correct the scoliosis and prevent it from getting worse over time. Most people with scoliosis are able to lead normal lives and do most activities, including exercise and sports. Being active is good for you whether you have scoliosis or not. Personally, I try not to let my scoliosis from stopping me from doing anything that I want to do. I'm very active in general. I enjoy exercising and I love running. And I do have a video about running with scoliosis if you wanted to check that out. Scoliosis can cause back pain, especially in adults. And the way that I deal with this is to keep my back and core muscles as strong as possible through regular strengthening exercises such as Pilates and regular physio as well, to keep myself as strong as possible. I do have a video on the ways I manage my scoliosis pain, so if that's of interest, please feel free to check that video out. How common is scoliosis? Although many people haven't heard of scoliosis, it is surprisingly common. According to the Scoliosis Association UK, around 3 to 4 children per 1,000 need specialist supervision for scoliosis. If you or your child have scoliosis, it's really important that you are seen by a scoliosis specialist. This is because the sooner that scoliosis is treated, often the better the outcome will be. If you'd like any information on finding a scoliosis specialist and you're based in the UK, I'd recommend that you contact the Scoliosis Association UK and they can point you in the right direction. I really hope you found this video useful. If you have, please leave me a comment below and consider sharing to help spread awareness of scoliosis. As mentioned earlier in the video, this is video 1, which is part of an educational series about scoliosis. So if you're interested in watching more videos like this, please consider subscribing to my channel. If you'd like any further information on scoliosis or you need any help, advice or support, I would recommend that you contact the Scoliosis Association UK. Thanks for watching and I'll see you next time.